I'll do this. Okay, it's being recorded.
Okay. Cool. Awesome. So I think I'll just do a little intro and thanks for joining tonight, everybody. And as we said, this is being recorded, so then we can share it for folks that couldn't join tonight. But Tracy and I discussed doing something like this, and we weren't sure like how in depth to get and like if it was going to be an in-person workshop or, and I think this is a really great way just to do an intro and talk a little bit about, the field of female physiology and how best to fit it into your training and vice versa, because it is so new for most people to think about it in this way. I think this could be just a fun kind of like beginner intro. And obviously, if I'm not like the expert, I've got some training in this, but certainly I'm still learning. And so too, I don't know if we can kind of go, if people want to introduce themselves, feel free, because maybe I have folks in the audience here who know more than me, which is, kind of cool. So we can learn from each other. But yeah, so I have been coaching athletes of all ages, all abilities for a couple of years now. Most folks know me as like a trail and ultra runner. And I've personally have been competing, since like 2014, I guess. And as I went along, I started to learn more about, training in general and programming for athletes and different things. And so got kind of into it and always been a little bit of a nerd anyway. And so I have taken some trainings with Dr. Stacy Sims, who you guys might know. And if Tracy, why don't you hold up the book that she wrote, Roar, so you guys can see. If you haven't heard of this book or heard of Dr. Sims, definitely look up Roar. I think it's actually like a 2016 release is when she put that out, maybe. So it's not like cutting edge anymore, but it's still pretty amazing info. And Tracy and I were discussing before we started that it's a bit overwhelming the first time you look at it. So it's really nice to own that book so that you can go back and reread just one chapter, about a certain thing you might be interested, or there's a lot of actually like exercises in that manual too, and like some nutrition guidance and that sort of stuff. So it's a really useful tool to have on your bookshelf, certainly. But so Dr. Stacy Sims is a physiologist who is actually American but lives in New Zealand, and she does a lot of research there, and started out with doing a lot of research in hydration and specifically how it related to women in our bodies, because she was a triathlete and found that most of what she was taught was all based off of men. And so historically, you find that most research is done based on men's bodies, and if you think about it, like, and what I've learned too, like, so I also work as a nurse. And so you learn even in nursing school that like most research studies were done on like college aged men that they've got paid like $20 to do a study, and and it was a control. There's no fluctuation with like there is with women, where things are going to be different because of our hormone cycle. And so most researchers decided to just discard, not include the women's population and just do men. And so you find that with a lot of different studies on specifically what we're talking about, exercise physiology, but in different medical fields too. So it's pretty interesting. And so I would say in the last 5 years, even maybe the last 8 years, you can start finding a lot of research based on women's physiology and how it applies. And Stacy Sims was starting with hydration, and then realized there was a huge lack of information in general about women's physiology and just exercise phys and how they overlapped. And so Roar is her first book, actually. And she is working on a second one, I think, but she, in that, goes into so much information. It's really, really exciting. So even though it's from 2016, it's still like pretty cutting edge considering, but there is more out there now. You can certainly do like a PubMed article search and you're going to find a lot more today than you would have 10 years ago. But so I figured it would be good to do like just a little background info on the hormone cycle. If does anybody want to intro themselves too before I get going here and say hi? Is everybody local too? Pretty much.
So I just unmuted myself. I'm Susan, local to Long Lake, although a lot of folks
Great.
up in Lake Placid doesn't think of Long Lake as being local. So that kind of cracks me up. But yeah, I'm in my 60s and do sprint triathlons. And you're right, there's not a lot of stuff out there to help in understanding of nutrition and hydration and exercise. And, I mean, even talking to my doctor about over a period of years, what should I expect? No one really knows.
Yeah. And, and I think too, for, women that are in menopause or post-menopause, that's even less studied, which is hard. So, and I will say, so Stacy also does a training that I've just barely started. Most of what she offers is all kind of online in this style. She does some in-person sessions, but most of it's a recording, so you can do it at your own speed. And so there is a specific class in menopause that I've started. And so it's, pretty cool, that we can now say, like, this is the best current knowledge and how you should be, optimizing your training, for what you want to do.
I'll tell you, if you have any feedback on where to go or who to talk to or whatever, I'd really appreciate it, because I'm frustrated by lack of information and lack of guidance. So
yeah. So I wonder, I can share, or I guess my email might not be in the email that you guys use to register, but you'll get all my contact info, and I can share with you, Susan, all of the Stacy Sims info, and you're going to be able to find quite a bit through her website. I think she does list some articles and things, but I can also send you some as well.
that'd be fabulous.
Yeah,
that'd
no
be great.
problem.
Thanks. Really appreciate it.
Sure. Yeah. And so it's, I've found, because I coach quite a few women that are, perimenopause and postmenopause actually. And it's been super helpful for us, I think, to like even, discuss this stuff, right? That we can talk about it like this, I think is awesome. Because it's something we all, as women experience. And because, right, if we want to, like, I think most of us that are into sports want to have lifelong sporting goals, so it is super useful. But I'll share that info later with you or via email. But anyone else want to intro and say hi? No pressure.
I'll say hello. I am local, Saranac Lake. I used to see you in the Paul Smith gym working out.
Oh, great. Yeah. Yeah.
And as the last woman said, I'm in my 60s, my early 60s, and I'm not training for anything, but I'm trying to stay fit and active. So, yeah.
Yeah.
That's it.
Yeah. So we'll talk, and I guess that, that's a good point too. Like if we have a crowd right here who, are in that age group, I can talk about that a little bit, because I was going to start out with just a general discussion of, kind of what the hormone cycle is, and which I think we should do anyway, and just go through it just so that everybody gets a refresher, because I feel like it isn't talked about that much as far as like the different phases of our cycle and that sort of thing. But then we can get into, what is going to happen when I'm in menopause and how do I best train. So we can certainly do that in the next hour here. Anybody else want to say hi?
Well, I'll introduce myself. For anybody that doesn't know, I'm Tracy, General Manager of the Medical Fitness Center, and my fitness background, this interests me very much. Triathlete, gravel bike races, I recently have started to get into. I've done, I've done a little bit. And my coach is who introduced me to the book Roar, and Dr. Stacy Sims, and then I discovered that Sarah was doing it. So I've been very interested in it. The fact that my coach is a male coach and was progressive in this really benefited me. I think even just the fact that he acknowledged that my abilities like fluctuated. I appreciated. So I haven't learned a ton, but yeah, I think it's pretty fascinating, and it's great that it's going in this direction.
And Tracy, that's a great point. I think, you know, if you're, for everybody, like if you're looking for a coach, like that's a question you should be able to have this conversation with them about, you know, you specifically as a female, and what does that mean, you know, and how does that coach approach that subject, and, you know, are they comfortable talking about it? Because I would totally assume there's tons of male coaches who aren't comfortable bringing that subject up with their female athletes, you know, so yeah, if you're looking for a coach, that's a good question to ask them, you know.
And Sarah, it's Susan again.
Yeah.
I think that's also valid for female coaches
because for sure.
Yeah, I had two, and neither one, I'm laughing at the idea, but neither one of us ever talked about our cycle or where I am and all that kind of good stuff, and never even thought about fluctuation.
Yeah. I think, great point, because as I was saying earlier, like I think it's only in the last 5 years that people have really started to realize, even, and me personally, I think it was only a few years ago that I was like, wait a minute, of course this is going to make a difference. And just never connected the two, honestly, you know, even though I've been training heavily for several years, it wasn't until a couple of years ago that I was like, oh, of course, like if, you know, I'm in my high hormone phase, it's gonna feel different than the low hormone phase, you know.
And then so it becomes like clockwork. You're like, oh, this is exactly why I have absolutely no energy and I can't do what I was doing like just
right
years ago.
Right. And, you know, and it's not to say like you shouldn't still try and like go out and, you know, do something, but have like some kindness and love for yourself that you can be like, you know what? Yeah, of course. This is not going to feel the same, you know? Yeah. So anyone else want to say hi or intro?
Hi, Sarah. I just wanted to say hi. It's Sandy.
Hi, Sandy.
I'm one of those older people trying to stay fit and active, and I'm 68, and I'm so happy to be able to play tennis again after multiple knee surgeries. And I've been training with Dino and before that with Sheila, and I just, you know, and many other people before that. And it's really good to keep your everything strong so that you don't need more surgery as you get older. That would be my advice to younger people. Stay strong.
Yeah. Yeah. You know, and so Sandy, yeah, I mean, so as we age, like, because we, our estrogen and we can kind of start in here, like estrogen and progesterone levels drop, right? Like after post-menopause, it becomes that much harder for us to build muscle. We like really, because we have no estrogen, which is a anabolic hormone for us, which builds muscle. When we lose that, we lose that ability, right? So, you know, and I think like for yourself, Sandy, because you're an active individual throughout your, you know, life cycle, basically, you know, it's so useful and helpful, you know, I think, and they have good people helping you now too, to like maintain that stuff and if not improve. And so, yeah, it's super, super important. Yeah. Anybody else want to say hi? We can get going. I'm going to share my screen. Oh, Rosa, if you want to put in the chat anything too, always feel free. You can put questions in as I'm going along in the chat too that I can go back to, or you can just shout out too. But Rosa says hi, so nice to meet you, Rosa. I run in Toyota all the time. Really love it out there. So I'm going to share my screen and kind of, I had made a kind of like visual for folks when I did a similar discussion for a thing over this in the spring. So let me share. Let's see. Okay, can you guys see that? What does it look like to you guys?
I can see it well.
Okay. Can I zoom it in? Like, would it be better if it was larger for folks?
Yeah, I think you could probably make it larger. Yeah.
Like that. Does this make it larger for people? Is that?
Yes.
Yep.
As well.
Yep. That looks great.
Great. So just, just for some like Bio 101, I wanted to show a few visuals here and graphs of like just really what the menstrual cycle is, right? And, because I think for myself, like after like high school biology, I didn't think about it that much, like, and, you as a young individual, I think, like I was on a birth control pill for a long time. So I didn't really even think about my hormone cycle, except for when I had my period and what that meant and where I was at with, the the OCP. And so I didn't really think about it until, just recently, and how this would affect my training, because that became more important to me. And so the first day of our cycle is the first day of bleeding. And so this chart starts out on the left there with day 1. And that would be your first day of bleeding, or menses. If you look at the, like the endometrial lining there, I kind of like this because you can see like the growth of what the lining would look like. And it lines up with like what's happening, obviously, in like the ovary and then in the endocrine cycle too, with the different hormones, and why we're going to go over why those things happen a little bit. But and one of the cool things I think about this visual, even this is from, I think, when is this from? This is from the 80s, but it's just mainly to talk about, like the actual physiology of the cycle. But at the bottom there, the body temperature, and you can see like during our follicular phase, which you're going to be talking about the low hormone phase, that's the follicular phase, which can last, about usually 12 to 13, 14 days for most people. The other thing that, I didn't realize up until a few years back is that some women can have a cycle that's 40 days long, right? So some women have a 28-day cycle, which I think is like you can see this visual only goes 28 days. And I think at some point in history, people took that as every woman has a 28 to 30 day cycle, but that's not true at all. They fluctuate, and it's normal to have an irregular length cycle also, which is interesting. So, I think one of the huge takeaways for everybody here is one of the largest things for folks in a normal cycle like this is to just track it, to start tracking it, and to learn where you are is super important. And so to go back to this visual, that bottom body temperature one around day 14, which is around ovulation, you see this huge rise in body temperature, core temperature. And this is in Celsius here. So it goes up a full degree Celsius, pretty much around that time for the rest of our cycle, which is getting into what we call the luteal phase, or the high hormone cycle. And so if we go back up to that first endocrine cycle, with all those different lines there, you can see how there's a huge spike at ovulation, which helps to release the egg, and then a bit of a drop, and then again a rise. And that's why it's called the high hormone phase, because you see P up there for progesterone as the high hormone during the luteal phase, and then estrogen, our luteinizing hormone, and our follicle stimulating hormone at the bottom there, which those don't fluctuate as much. But all of, like what we talk about with PMS and this high hormone phase, it's going to feel harder to do exercise during this time for most people. And that's another thing, big takeaway is no one is the same, right? It's all very individual. And so it's really learning what works for your body and how your cycle, affects you. But so this is a really cool vision. I think it's interesting that even back in the 80s, people realized okay, but still didn't really connect in the exercise world at this point, because there wasn't that much, women, that's a whole different conversation, but that realizing that your core temperature going up is going to be worse for your sleep, harder to reach a sweat threshold, and make exercise feel harder and actually harder, and reaching a fatigue level quicker. This really hasn't, I don't think, really been talked about until the last few 5 years. So it's something that's super important. We'll get into why, as we go along here, and how we can also mitigate some of this stuff too, so that, you know, the high hormone phase doesn't become like your worst nightmare. It shouldn't. You know, there are things we can do to try to like offset some of those symptoms. People have questions about this visual, this graph at all? Okay. So the main players, the main hormones that we talk about, estrogen. So there's actually 3 different types of estrogen in our body, but when we're talking about it, we're talking about E2 or estradiol. So basically that's the only one we really are going to be talking about today. Progesterone, follicle stimulating hormone, and then the luteinizing hormone, which we saw in that upper graph there. I mean, you guys can all read what this says, but just, yeah, let me just go back here for a second so you can see what's happening in the ovary. And, you know, we have the luteinizing hormone, the follicle stimulating hormone that helped then release the egg, and the progesterone, which is actually what gives us kind of those, the cramps and that sort of thing, and then estrogen. And so we're going to go down a little farther here and talk about what these
Sarah,
are doing to us. Yeah.
so being a post-menopausal person, I'm going to be a little selfish here and say, you know, can you add to what you're talking about for those of us who are either peri or post-menopausal? That would be great.
So yes, so for you folks, so I'm going to finish kind of going through like what the normal cycle was like.
Sure.
And then,
sorry.
No, that's okay. And then, I don't know if I put it in here, but I have some other.
No, keep doing what you're doing then. No worries.
But yeah, we'll talk about that a little bit. So I think, you know, what happens, well, I'll talk about it with this one. So what happens is as we age, and you get closer to, you know, perimenopause. So I'm 36. So for someone like myself, like it's not far away. You know, people in their late 30s can start experiencing, different perimenopausal symptoms, and fluctuations in these hormones. So when you're in perimenopause, this top endocrine cycle graph would kind of just be all over the place. There wouldn't be, like, this is a very typical, this is what you're going to see for someone who's on a natural cycle, you know, every month. And it might get longer, shorter in a few places, but it's always going to have this, you know, ovulation, spike at ovulation, and then the high hormone phase and the luteal phase, and then a drop off for the menstruation. Now with perimenopause, so, you know, when you start to first experience like hot flashes and those sort of things, you're going to find just huge spikes all different times of the month. And once you're in post-menopause, you're going to just kind of have a flat line, honestly. There might be a little bit of ups and downs, but, you know, after that, you're basically just going to be like a flat line.
So we're flatlining, huh?
Yeah, kind of. You're going to see, you're going to see, you know, some luteinizing hormone and that sort of stuff still there. You know, and I don't know enough about to say, you know, there's a lot of, you know, hormone therapy and stuff that works for a lot of women, because you can, you know, and then there's all sorts of, right, like other things that are happening during that period where it can be pretty debilitating, you know, for people, and can really throw your life off and that sort of stuff. And so there are options out there, you know, like even getting a hormonal IUD can help for folks, which is sort of interesting. And I've only done a little bit of looking into that stuff. But it does help to replace, you know, some of that progesterone and estrogen, to normalize things a little bit if you're in a perimenopause state. You know, so if that's anybody here, like, you know, you want to talk to somebody about that, who, you know, your gyno or somebody, but there's options out there. Obviously, you know, during perimenopause, you might still have, you know, a little bit of like some egg release and stuff like that. And obviously there's lining buildup and shedding and spotting and all sorts of things. But, and that, which then leads us to this body temperature line. And that's why you get those hot flashes, because we have this rise in body temperature because of this rise in progesterone. And so during perimenopause, when you have all those fluctuations, you're going to get hot flashes because your body temperature is rising and falling, which then, you know, leads to poor sleep and all those sorts of things. Let me just show you just to...
Sarah, I have a question. Have you found anybody who does testing to see where your hormone levels are at? Because I know that's a hard thing to get physicians to do.
It can be. Yeah. And a lot of times, you know, I find, so I think I mentioned I work at the hospital as a nurse, and in healthcare in general, like you'll find a lot of our primary care providers, because we're in a rural area, they don't specialize necessarily in this, right? I think if you have a good relationship with them, and I would think too, a good gynecologist should be able to order this stuff for you too. You know, especially they should be able to do that for you. I have talked to some of the gynos, like locally through Planned Parenthood, and they've been super open to ordering different, you know, like sex panel hormones and stuff for me. But it's kind of tough. Like, you know, healthcare I find is very reactionary and not super progressive. And so unless there's a problem, it's hard to justify testing for things, I think, for some doctors, only because then if there is an issue, say, they don't necessarily know how to treat it and follow up and what to do there. I do think you can, Dr. Christensen, who works out of the health center in Tupper Lake, I know she does some like endocrinology work. So I think she would, you know, she's pretty knowledgeable about this stuff. And she's also like a infectious disease specialist too. So she's a little more specialized. But yeah, it's tough. So there are some other options too. There's Inside Tracker, which I've kind of talked about a little bit in the past, is a sort of like home, like do-it-yourself blood testing. You know, like a phlebotomist comes to your house and draws, or you go to a lab and they draw your blood, and it's a bit expensive, but for their full test, you get the full sex hormone panel, and it would tell you, you know, everything you needed to know. The cool thing about Inside Tracker, oh, go ahead.
Sorry to interrupt you. You can do that here, because I looked into Inside Tracker to collaborate with the facility, and they looked into if they could get somebody here, and they can't.
So so I haven't tried real recently here. In New York State, there's a law about this home testing. You have to have a phlebotomist come to your home to draw, and they've had a hard time getting a contracted company to travel to our area.
Right.
Sounds like. So the last time I did it, I went to Vermont and had because in Vermont, you can just go to a lab that's contracted under Inside Tracker, and they draw right at the lab. So the most recent one I did, I was, I think, flying out of Burlington anyway. And so I went over and had a blood draw that you just go to a health center with, that I think was right in Williston. And so that worked out fine. But yeah, no, and I've talked to Jonathan, who's kind of Jonathan Levitt, who's their marketing guy. And so they're working on it. He knows that we're like hurting up here for that.
Yeah.
And for a while it was like New York in general, I think, was like out, and now it's just our area. So if you're in a place where you can like, drive to Vermont easily, or I think maybe if you're closer to downstate and have the availability to have somebody come, like, because they can come to your workplace, they can come anywhere to do this, draw. So if you're like, you know, they could meet you somewhere downstate too, probably, but it's a bit awkward right now. Yeah. The other thing, so in order to find out, you know, where you are in your cycle, you can also do like, there's home tests you can just order on Amazon that will kind of track your, like, just like a P test kind of, that track where your cycle is, mainly for like family planning. You know, you find them for that a lot. And so you can also use that to kind of like see where you are. If you're a woman that's thinking she's like in perimenopause and they're wondering, your primary care should be able to order you that luteinizing hormone test to see, because that's what you want to look for, because it's going to show a reaction, you know, a certain level once you're in perimenopause that it wouldn't normally show. So, so just kind of going back to why we're feeling all these things, like, and what we're missing once we do enter perimenopause or menopause. So estrogen, you know, and I always feel bad because I feel like I make these hormones sound like they're like the worst, but they're doing us a lot of good. But the bad things, I guess, sometimes that are happening, like the reason we feel like we're bloated in the high hormone phase is because it's, you know, increasing some fluid retention. Let's see. It makes us, we get more fatigue because, so estrogen is one of the hormones that crosses the blood-brain barrier. And so it kind of excites our nervous system, which then makes us feel tired for no real reason. It also, estrogen, when we have that high estrogen, sometimes it makes women actually quite like empathetic and like, not empathetic, but like, what's the word I'm trying to think of here? Like more friendly, like they're not friendly, like they just want to be around other women, I guess, like want to like communal, and it's sort of interesting, but sometimes it also makes you just sort of feel like you have no motivation, mainly because you're lacking those the serotonin. The estrogen crosses your blood-brain barrier and can occupy the same place that serotonin would attach to. So that's why you can feel more depressed, or you feel unmotivated, or you just don't, you feel some brain fog maybe when you're in high hormone phase, and that's that can all be why. Now progesterone is why we have that increase in core temperature. So the increase in the progesterone causes our core to go up, which then delays the sweat response. So sometimes when you're out biking or running or doing something in high hormone phase, it takes you longer to start to sweat, and then it just makes it feel that much harder. And you also have saltier sweat, so you're actually putting out more sodium during high hormone phase. We lose a little bit of plasma volume in the high hormone phase as well, which means that our blood is a bit thicker, and then that causes our cardiovascular system to work that much harder, and our respiratory system as well. So folks with asthma or respiratory issues, you know, you might find that during the high hormone phase, you're more susceptible to having, you know, an asthma attack or, you know, something like that, because you're going to, respiratory rate might already be elevated. The good things that, you know, some of these things do, like progesterone helps us build bone. It also is kind of, we need both, because the estrogen is anabolic, it helps us build muscle, and the progesterone is kind of catabolic, so it like stops the muscle growth. So it's sort of like a checks and balances system also. Let's see. We can talk a little bit about nutrition, and we can talk about how that applies for folks in menopause too. But, you know, during high hormone phase, we have a harder time accessing our stored glycogen. And so the real important thing during high hormone phase is fueling for your activity during the activity. So if you're out even for like an hour, it's a good idea to bring something with, you know, some sugar in it, so that you can actually just fuel as you're going. You know, in low hormone phase, it's not so important to be thinking about that. It's important to take in nutrition around the activity. And actually, when you talk about, like, for the triathletes and so, like carbo loading, right? You always hear people talking about that, and it doesn't work if you're in high hormone phase. You're not going to store that glycogen the same. But if it's a low hormone phase, yes, it will work somewhat. You'll be able to store a little bit more glycogen. Yeah, so to go over just kind of those two, because these are the main players that really, you know, are going to be affecting us when we're trying to do our exercise. Yeah, let me just see. This is just, I think, another visual here that I'd put in. This one from 2019 from a study that they were doing about like estrogen on performance and injury risk, but mainly in lifting, athletes that did a lot of lifting. One of the things that happens is the estrogen, they kind of like, because it's to kind of prepare your body, the rise in those hormones is preparing your body for menses. So you're shedding the lining. It's an inflammatory response, but it can also create kind of like an elasticity in your tendons. So, you know, you've probably heard of like soccer players, I think is one big one that's been studied, and they find that they all tear their ACLs around the same, you know, not the same time, but like if you look back, you could see that they were all in the same hormone phase when they did that. And so some of the ways to offset that is you just have to be, you know, a little more thoughtful, I guess, but also warming your body up a little bit better. Maybe doing your training, you know, less kind of high impact work at that time of the, you know, cycle, and more, you know, maintenance work, that sort of thing. We can get questions. Anybody got? Let me see. There's a chat question there.
So Sarah,
yes,
being postmenopausal, I'm assuming that I don't have to do hormone testing. I'm assuming since we're a flatliner.
Yeah. So, I mean, if you know where you're at now, you know, because you can be in like a perimenopause for a long time. And you know, it can be frustrating, and, or you can be unsure, you know, you can kind of like feel like maybe you're headed into that zone, but maybe you're not totally there. And so that's where, you know, getting like that luteinizing hormone test would be good, just so you can really see. And I say, you know, the tracking stuff is super important, because then you can, you know, for someone who's still in a natural cycle, like you need to know when these two phases occur, right? Now, someone who is in postmenopause, and you're, yeah, we could say flatliners, you know, you have just a pretty steady state, which is kind of great, because you can now do, you know, like a 6-week training block or 40-day training block, you know, more consistently. Obviously you need to have some rest in there, but without having to worry about this, you know, like increased core temperature from progesterone, or, you know, in the catabolic state that you might be in with that high progesterone. Yeah. So if you know you're in postmenopause, right, you don't have to do all the, you know, you don't have to worry about all that, but more, it was just kind of an informative that those things are available, you know, if you're unsure of where you're at.
Got it.
So the high progesterone state is where you're more prone to injury?
Yeah. You know, well, it's actually kind of like right near ovulation, and headed into the high hormone state. Yeah. You know, and the other thing too, you know, with, because it's a kind of like an inflammatory response, right? Like having these high hormones, immune response is also a bit limited too. So you have to, you know, you want to think about that as well when, you know, like if you're really fatigued, plus like you're around a lot of people at work, and like, you know, especially when we talk about, you know, like with COVID and all these things, like just to be aware, like maybe some of the things you could do is like take a little bit of extra zinc, you know, in the high hormone phase, not only for cell building, because zinc is necessary for that, but just to help with immune response too. So again, this is a 28-day cycle applied to a periodization, but for someone in a, you know, postmenopause state, you could do a 40-day cycle and not have to worry about these things, where you could do, you know, a couple of weeks of, so I guess to backtrack a little bit, you know, with those folks in menopause, the big thing for you guys is, you know, maintaining your muscle mass that you already have. It's a lot more difficult for you to build muscle without that estrogen. So, you know, you want to be doing a lot of strength work, a lot of like high intensity interval work. And you can do that in a cycle where you're going maybe day 1 and 2, you do a couple of different, you know, intensity sessions in the gym, and then maybe day 3 you rest. Day 4 and 5 you can do another, you know, 2 sets of high intensity, and with you know, so you can do 2 days in a row of that with like then a rest day that's maybe just some like, I hate to take away anything from anyway, like doing long, slow runs, especially for someone in menopause, isn't necessarily like going to make you more efficient, but if it gives you like mental clarity and it's what you love, then definitely not taking that away from anybody, like we keep that in the schedule. So for someone in menopause, I'm still talking about, you want to be doing a lot of high intensity work and working with somebody that, a trainer that, make sure you're doing those moves correctly. Right. I find mobility and that kind of like prehab stuff is super important too, and have tried to make a habit out of including that in all my training now, so that my base is at a good place as far as then heading into heavier weightlifting and that sort of stuff. So the other thing with folks in menopause and that lack of estrogen, and you want to be doing strength work and high intensity work. So if you're a runner and you love to run, it's doing those like sprints and interval sessions. If you're same with biking, doing some, high intensity bike work and that sort of stuff too. And the other really important part of that is nutrition. So with some folks in menopause, you really want to be thinking about like really quality protein. Definitely, you need carbohydrate obviously to fuel, but you also want to make sure it's, quality carbohydrate. That's, fruits and vegetables and grains and that sort of thing.
Hey, Sarah, now that we're talking about nutrition and protein,
Sure.
for somebody like myself, powdered protein, is that something that we look at and we say, yep, thumbs up, or try and find it more organically?
No, yeah. Well, both, you definitely want to, so I think in general, for a long time, we've all been trained that, I think, and we've heard too now about a lot of like low energy ability issues, for females, but also males now. And so they've, I think the thought process is changing a little bit on how, like diet culture and all that sort of thing, and so I find for women especially, but also men, we probably just aren't getting enough in a lot of times. And so a lot of that, and not enough quality, right? So all that to say, yes, I do think powdered protein is a good thing because it's easy and you can get it in right away after doing some strength work or high intensity work. And then, also having quality protein at home for a meal, once you get home. And so I don't have it out. There's, you want to be getting, for someone who weighs, you basically want to be getting like a gram of protein a day per pound. So like you should be getting over 100 grams of protein, which is a lot for a lot of people. And you want it to be quality, but you can also get it through protein shakes and that sort of thing. And I tell most of my athletes, like after an interval session, you should try to have a protein shake pretty much immediately, especially for women. That's a huge thing to help with muscle building. And so one of the things you want to look for when you're looking for protein powder is something that's quality. For women, especially, whey protein actually is probably the best, most absorbable protein that's going to benefit us. And that's mainly because the amino acid leucine that's in whey protein is super important to offset like that catabolic state that you kind of go into with muscle breakdown. It starts the muscle recovery. So, and for women, still in a natural cycle, that leucine is super important also during the high hormone phase to help with brain fog. It can kind of help clear, some of the estrogen. So it's super important. I've tried lots of different types. I think right now, actually, so I partner with Tailwind Nutrition, who makes a really nice like hydration mix, which I use so I can get a constant flow sugars when I'm running, but they also make a recovery mix, but that actually is a pea protein, but it works okay. You know, if it's, you know, whatever you can find that's kind of high quality, has a good amount of protein, but you do want to have, you know, it depends on when you're taking it. But a little bit of carbohydrate is good also. So like if you're making it yourself, you want some berries mixed in there, you know, with maybe a little bit of honey or maple syrup to help right after a intensity workout too.
Can I ask a question? You keep referring to quality protein, and somebody
So-
where I am, I'm thinking like chicken versus some other, but what does that mean, quality?
Yeah, I guess, you know, I guess what I'm thinking in my head is like a processed meat versus like a chicken breast or even steak or, you know, I used to be a vegetarian myself, like in high school, and I haven't done that in a long time, but it's super difficult as a plant-based athlete for some people to find enough, because, you know, you have all those processed meat alternatives. Those are terrible. Not going to give you, you know, the really what you need to help with muscle rebuild. So yeah, when I say quality, I guess I'm thinking, you know, yeah, like an actual, chicken breast
Real life.
versus, like, or, you know, salmon versus, you know, something prepackaged. But,
Got it.
again, like I also tell all my athletes too, like, you know, life happens, right? Like there's many days after a 12-hour shift at the hospital that I don't really like, I'm not going to make a full meal, you know, like, so yeah, I have like a frozen pizza, or I have, like maybe it's a frozen like salmon burger or something, right? So like I wouldn't consider that salmon burger necessarily a quality protein, but it's still a protein that's gonna, you know, it's life, you know?
Okay.
So yeah.
Got
So
it.
just, you know, doing your best, right? So I guess, let me see, what else did I put in here? So to go back to folks that are in a natural cycle. So, and I keep saying natural cycle because there's a big difference between a natural cycle and someone who's on birth control. You know, one of the things you want to think about with birth control is that you're basically getting kind of a constant flow of hormones all the time that aren't natural hormones. They're not the exact same thing that's in our body. And to be honest, like if someone were to ask me if they should not be on one, I would probably say yes. But obviously it all depends on the scenario and the situation. And, but it kind of puts you in a sort of like high hormone state all the time when you're on a birth control pill. Again, like sometimes people are taking them for a medical reason. There's all sorts of stuff. So like, don't, definitely talk to your doctor and gynecologist about that sort of thing before ever changing anything. But there are options out there, you know, and different things we can talk about too. But so somebody on a birth control, it's going to look a little bit different. Like you don't have, really the best thing you can do with somebody on a birth control pill is tell them to actually take their birth control. It depends on when they work out. If they're a morning exerciser, they should be taking their birth control pill at night because they actually have a bit of a half-life. And so you are going to have the lowest amount of hormone kind of circulating through your system, you know, 12 hours later. So if you take your birth control at 8 p.m. and work out at 8 a.m. would be ideal type of thing. Or if you're an afternoon workout person, you know, you want to take it first thing in the morning, and hopefully by then things have kind of dipped a little bit. And for those folks too, you know, I didn't talk a whole lot yet about like when you're in the high hormone phase, there's certain things you can do to kind of try to offset some of those symptoms of PMS and inflammation. And, you know, like you can take, you know, like omega-3s that help with inflammation and that sort of thing, you know. And so if those folks that are on birth control, they can experiment a little bit with, you know, trying some supplements that maybe will help them, you know, for sleep wise. So they, you know, maybe they've been on it for so long and they don't notice it anymore, but their sleep maybe is a little disrupted too on birth control. So trying to keep the room cold and that sort of thing, you know. When for someone in the natural cycle and high hormone, you can, you know, drink something cold right before bed to hopefully lower your core temp a little bit, you know, use a fan, that sort of thing. Yeah. I will like, Trace, I'll send this to you, so because this you could print out if you want to, you guys, for home. This is just another way of kind of laying it out, where different things that should be happening in different phases of your training for your cycle. This is one way to kind of lay it out. I like this way too, so I'll leave it here for now. But remembering back, so the follicular phase is kind of our lower hormone phase, and so that's a good time for folks to be working on, in a natural side, to be working on high intensity, VO2 max work, and maybe you do an FTP test then. Races during that time are good. And if you're weightlifting, you can do, more high weight stuff. And that's all because, like we said, with those lower levels of estrogen and progesterone, you still have some, for the anabolic ability to build muscle, but you're also going to recover better because you're going to sleep better. You're accessing those stored carbohydrates and glycogen, without those high hormones. So that's a good time for that. Sometimes women at ovulation, because if we go back and look, there's a bit of a estrogen rise there. They feel really good at that point. And that's where, in maybe an ideal world, you are racing right around your ovulation. Actually, sometimes women can tell they're ovulating and have some cramping or spotting because of those rises in hormones too, though. So, like I said, everybody's different. Sometimes right after ovulation, people feel amazing too, because you have that kind of quick drop. And maybe that's a great time for somebody to do like a PR or set, go out and do a time trial, that sort of thing. As we get closer towards the high hormone phase, you want to be more cognizant, like I was saying, of that, increased core temperature, increased, injury risk, really, and lack of recovery with lack of sleep and that sort of thing. And so we want to be pretty diligent about our nutrition at that time, our hydration. If you remember back, I said that increased progesterone increases our sodium loss. And so, we want to be really careful about making sure we're getting enough, especially right now when it's so hot. Also too, if you're racing and you're somebody who does an ultra distance event, that's the time where hyponatremia could maybe potentially be an issue, because if you continue to drink water and your sodium's already low, that could be an issue. But the good things to work on at that time are maintenance things, just to kind of go out and, if you're running, just be doing, normal runs. Stacy Sims does recommend doing some technique work, which is kind of interesting because the fact that you have a bit of brain fog and a bit more high hormone stuff happening, if you're able to, if you're a mountain biker, for example, and if you're, working on skills, you should work on it at this time, because if you can dial in a skill when you're already in a brain fog, you're going to perform it that much better when you're not. It's kind of her thought process there. But it's kind of, it can be frustrating. I should also say that, when you feel you just have no mind body connection, or you're running and you roll your ankle, those are the sorts of things you have to kind of be careful of and be cognizant of, that, might have to be more likely to happen. Yeah. And then, if you are doing some strength work, maybe a little less actual weight and just more reps. Some balance work is a good thing to do at this time, again, because it's going to feel a little bit harder, but it'll make it easier when you're not in that phase. Yeah. And just kind of some maintenance stuff. And it's a good time, talking about mental health and stuff, that, it's a good time to be kind to yourself at that point, and to realize oh yeah, this is going to maybe feel a lot harder than it would in a week from now. It's also a good thing, if you train yourself, or if you have a coach, to talk to them about when this falls and say, look, I just can't do this workout this week, but next week is going to be fine. Maybe you can move it around. Sometimes women, though, week one of their cycle, when they're in menses, is terrible. You do find with the shedding of the lining, that you have a little bit more like cramping and sometimes GI symptoms and nausea and lightheadedness and that sort of thing. So again, everybody's a little bit different. So you have to kind of figure out your cycle and how you feel and what can go where for you. And that's where I think this one comes in kind of to print this out. And so, you know, sort of where you are in here. Questions, thoughts?
I just want to comment on what you said about letting your coach know how you're feeling. I think whether you're working with a coach or you're just trying to be fit and active yourself and you're not training for anything, and being honest with yourself, I think that is huge. Being honest with your coach and not feeling like I have to stick to this training regimen, and being okay to fluctuate, like giving yourself that permission will help you in the long run. Like you're not setting yourself back by not getting that workout done that day.
Right. In fact, you know, you might even be setting yourself back if you attempt to do that workout, because you may not recover very well from it, and you potentially could be, you know, opening the door for an injury, you know. So yeah, so it's super important, you know, to just be like, you know what, yeah, I'm going to try this again next week. This is just not the week for it. And, you know, I think, like I said, tracking. So I know you said, Trace, the Fitter Woman app is great. And
I found it to be very consistent, like with my cycle, like it's like on the dot, like it seems to be very accurate. So I've had good luck with that.
There's, you know, I think even just the iPhone you can track your cycle with now. In health, I think you can just kind of put it in. I think it gives you updates, I believe. I haven't really used it super closely, but that's one I think some people have used. And then I've been using one called Wild AI. And I don't know actually if it's open to the public. It was like it was like a kind of a trial app at one point, and now I feel like it is. I can show you guys what it looks like. But it's pretty cool because it gives you, I don't know if you guys can see this, probably not. No.
It's hard to see.
It's hard, but you can track it. It just gives you a lot of pretty interesting information. And it's interesting to track, you know, like your motivation and your sleep pattern, and that it does all of that as well. So Wild AI is the name of that one. But yeah, I think, you know, for most people that are still in natural cycle, that's the first step. For those folks that, you know that they're in menopause, you know, adding in more intensity and focusing on like a clean nutrition is really important for them.
Thanks. I'm embarrassed to say for all those years, I never even thought about my cycle. So now that I'm a flatliner, it's good information, but it's good stuff I can pass on to our daughter-in-laws and all that kind of good stuff. So I appreciate
for sure. Yeah, you know, and I think that's what I find like the most exciting is when I can just go out for a hike with other women or anybody, and like we talk about this openly and say like, you know, or it's like, you know, somebody will say like, I just felt so clumsy, you know, or like I couldn't do what, you know, what I would normally would do. And I was thinking like, well, here it could be that you're in high hormone phase, and maybe this is why, you know, and just for a lot of folks, I think it's kind of eye opening, and they think, oh, okay, yeah, like it's just, yeah, I think it's a good conversation.
It's a great conversation. It's one we should have more frequently.
Yeah, which I think is happening. It's starting, you know, I think. You know, and maybe it's just that, you know, on all my social media platforms, I'm following these people, so I'm seeing it more. but they're out there. You know, there's another woman. What is her Instagram handle? So I've been on a totally separate topic, kind of side note. I've been using a glucose monitor. I'm not a diabetic, but it's been interesting to see what happens during my high hormone phase and with my glucose. So because I think I do a pretty good job, I guess, now at this point. So it's really not that eye-opening. It's just sort of confirming what I'm doing is helping continue to keep my glucose high for activity. But you can tell that, you know, like maybe if I'm at work one of those days, though, I'm not accessing my stored reserves, right? So like my blood sugar is dropping during high hormone phase until I can eat lunch or do something. But during activity, I can be sure that I'm taking in, you know, for me, it's tailwind, but for somebody, you know, you guys, there's lots of options out there for, you know, liquid nutrition that's going to give you the sugars you need. And so it's been pretty interesting, but there's a woman, sorry, I started this conversation because of this account, and I think it's Glucose Goddess is her name, but she provides a lot of info about different food sources and how they affect our glucose. But it also applies, I think, you know, if you look at it from a athlete standpoint, you know, how those things are going to fuel us. But it also is probably pretty helpful, you know, thinking about it now for folks in menopause too, and like how, you know, she'll talk about like the difference between a white and a sweet potato, you know, and like where those spikes occur and stuff. And so for somebody in menopause without, you know, that those anabolic abilities with estrogen, you know, it's important to be thinking about, yeah, like the timing kind of nutrition too, and where you're getting that protein in. And so for those folks, you know, as soon as you're done with the workout, you should be trying to get in that protein. Yeah.
That's great to know. Thanks so much. Really appreciate it.
No problem. Other questions, thoughts?
Hi, Sarah. This is Liz Purcell. I was curious. My daughter is about to be 16. She does not have a regular cycle, and she's training pretty hard. She's a ski racer, so she does, and she has coaches who are monitoring that. But I guess my question is something to the effect of not a regular cycle, and how I can support her, or how I can support her. And I guess, yeah, we're talking about a year, maybe a year and a half of a cycle, and it's, you know, it's on for a while and then it's gone for 3 months. And, you know, I've talked to her about birth control just so that she could become regular. So I'm wondering if there's a natural approach I can help her with, or what your recommendations are.
I mean, so for her, you know, it's probably actually still normal for her to be somewhat abnormal, you know. That's not like that's not out of the ordinary at all. You know, it's going to take a little while maybe for her to find that normal cycle. But I think the best way to be, you know, for you to be confident and for her coaches is to be sure she's getting enough protein wise and calorie intake wise, and recovery wise, right? Like I find sometimes when I like talk to cross country runners or high school athletes, and right, these folks that are doing several sports sometimes, you know, when they overlap in seasons, it's, you know, the recovery is, I think, just and for everyone even, is just as important as the actual training in itself. But for her, I think like I wouldn't be super concerned yet with the abnormality and the length and kind of like and missing, but it, you know, if it continues, yeah, you know, and you also want to like monitor, you know, I'm sure you can tell, right, when she's fatigued and tired and frustrated. You know, and if she is expressing a lot of that, you know, there might be something there that's a little more concerning, you know, if it's pretty frequent, because then maybe that is a combination of kind of a low energy availability happening there.
Right. Okay.
You know, so I think, you know, providing, you know, like as it's super hard, I guess, you know, I don't have kids. I think for me, it would be for, you know, and for, if I was coaching someone, you know, in that age group, it's providing the conversation, you know, when she's wants to talk about it, right? Because that's hard. And hopefully, you know, like making it an open conversation with her coaches too, again, very hard, especially if, are they men? Are they male coaches?
I think they're mostly men, but there are some women around her. So
good.
And
good,
she's
yeah.
really open with me. So it's not
Great.
it's not difficult for me to talk to her about it. But I do notice she becomes fatigued easily, and you know, so yeah, it's probably nutrition and just
Yeah, you know, so I think it's and right, so just providing the things there, you know, and encouraging the intake of, you know, that nutrition.
Right.
And, you know, like, you know, hopefully providing a structure where it's like she, you know, knows the rest is just as important. And I think most coaches are good about that in this zone, but I don't know for sure, to be honest. I don't work closely with anybody that age group, but I found, you know, like the cross country coaches and stuff in the area, they know, you know, like that rest is just as important as the actual
Right.
training itself, you know, but yeah, then, so I wouldn't be, you know, like I said, I think it's normal for her to have some of that irregularities at this age right now, but if it continues, or you notice in conjunction with some of those other symptoms.
Right. Okay. Thank you.
Yeah. No problem.
Sarah.
Yeah.
This is Sandy. I was wondering, I was wondering about good quality protein for vegetarians besides just mixes. And I was like, when you said you don't even think a frozen salmon burger is
Well,
good quality.
I shouldn't say that, but you know, it's like it's just whatever I get at Aldi, you know, like,
right.
And so it's not terrible, you know, obviously, but it's not as, it's not a salmon fillet, right? Or like, it's a bit different. And
Right.
so, sorry, I don't know if I let you finish your question.
No, it was just, I'm, you know, I'm a vegetarian most of the time. I very rarely will have some fish, or very, very rarely some chicken, but that's it. But Chip and I have been eating a lot of the meat substitute, you know, pea protein burgers and things like that. But just, we know we need protein, but I'm just trying to find it. And then also Lisa asked you in the chat, as I had asked, you know, can you name any quality whey protein powders for us, or, you know, like, how do we know what's better than another?
So, you know, you want to look for like some like there's certain quality seals on a lot of products, you know, that you it's like athletes look for things like that are clean in sport, you know, that are kind of certified, so there's nothing in there that we don't know about, you know, that might pop up on a test or something. But a lot of those companies, those are, you know, good quality proteins. As a vegetarian too, you do want to be making sure you're getting in like that leucine, which like almonds have a ton of leucine. There's also some like fermented branched chain amino acids out there that you could add to smoothies and stuff too as a vegetarian, that, you know, you're not going to find some of those BCAAs other places as a vegetarian. So like brand wise, a lot of them have like quality seals, you know. There's I'm trying to think of like the last one that I used that was quite good. I'm like looking at my counter right now. What do I have over there? Because I've honestly been using a lot of the Tailwind stuff, but it's
called Tailwind,
but, and that's a pea protein. So, you know, if whey protein is obviously a dairy product, but
that's okay.
Yeah. So
I cheat with dairy products.
Okay. Good. So, you know, like Greek yogurt also has a lot of leucine in it. That's a really good one to add in. And you can even do like a smoothie with some Greek yogurt in it, plus a scoop of some protein powder. I can, you know, Sandy, if you want, what's your email? Or actually, everybody, I can send out because I'm sure everybody wants to know kind of, but I can send some thoughts for some quality like whey proteins.
That'd be great.
Yeah. Because of course I'm just blanking right now on the, you know, there's like a site I use called Emerson Ecologics, which is like a wholesale site for healthcare providers, but they have a whole system of their own that they use to kind of certify products, you know, that then that's how kind of I go about it. But like, you know, it's the same idea as something like a Clean in Sport, you know, that is basically they have to hit certain criteria that their products are certified, you know. So, but yeah, you know, and there's a lot out there, you know. I think some of those, you know, whey proteins that you find at like CVS or something that are just like a big bulk thing, those, you know, you kind of want to take a look at those labels and see, like, are they just kind of putting a bunch of info on there that's there to like distract you and look good? Or is it actually a, you know, like certified for, you know, sport or something like that?
Okay, well, I'll look forward to getting your suggestions.
Yeah, right. Tracy, we have everybody, you have everybody's info kind of.
You know, I only have those who signed up through our software, so everybody should send in the chat your email. Would be better.
Or I can just put my email in there, even if you guys want.
Right.
Whatever you guys want. I'm gonna stop sharing my screen actually that way. Sorry, I couldn't see the chat actually until now.
Naked brand protein is I think okay.
Yeah, you know, I think there's like I said, Gal, I'll do a search based on like the criteria I was talking about, and I can give you guys some ideas. Mm. Yeah, and so yeah, your BCAA content, like that's something to look for on it too. You know, like if you're looking at your label and you want to see, you know, how much leucine is in there and lysine, and you know, like if it's only 50 milligrams, that's really not enough. You want like a couple of grams typically of BCAAs in there. And collagen too, you know, that's another one that there's, you know, it's kind of like one of those hot words, I guess, lately that they've put a lot of marketing in and stuff, but there is some research behind it that it is helpful. And so there's a couple of brands that I like too. I've actually been using I think it's like a Dr. Axe product, but it's certified and it tastes good and it like dissolves in my coffee immediately and you don't even notice it, that sort of thing, you know. But it's a collagen with like 10 grams of protein. So that's another way to like add in a little bit of protein to your day. And also it's pretty much flavorless. So you could add that plus some Greek yogurt, plus a scoop of protein powder into your smoothie. Other questions? Cool. So yeah, I guess if you did not register through the fitness center, email me, and that way I have your contact, and then I can send out a kind of a info list of stuff for people.
Yeah, and we'll get you the email addresses that we have.
Great.
Yeah.
Cool. Yeah. So you can find me also, I mean, I'm on the social media stuff, but there's my email there. And then our like coaching and guiding and kind of website is called easternmountainendurance.com. So you guys can check us out there. And I haven't really been in the gym that much, but sometimes I'm there. So feel free to come up and say hi as well.
Well, thank you so much for doing this. I think we had a great turnout, and it was
yeah.
So
hopefully it was educational for everybody. And
yeah, I thought it was. Thank you.
Thank you, Sarah. This was great.
Yeah. Thanks so much.
Yeah,
it was great.
Thank you. Good to see you again.
You too, guys. Great to chat and hear your voices. Awesome.
Hey, all right. So I will try to figure out how to get the recording out there as well.
Okay, perfect. That sounds great.
Thank you.
All right. Bye, guys.
Bye-bye.